My name is Makayla and I'm reporting for Healthy Newsworks from Philadelphia, Pennsylvania. On this video call with me is former U.S. Health and Human Services Secretary Kathleen Sebelius. She also served as governor of Kansas. Thank you so much for taking the time to talk with us today, Secretary Sebelius.
Good to be with you, Makayla.
Kids want to get back to school safely. What steps need to be taken for that to happen?
Well, I think a lot of the scientists feel that school openings are important. It's important for kids to not only learn, but a lot of children in America rely on schools to be safe while their parents are at work. They rely on schools to get 2 meals a day, to be playing in safe surroundings. So schools have lots of very important aspects for children and for their parents. But schools are spaces where kids sit close together in the classroom. They eat close together in the lunchroom. They go out to playground space or participate in gymnasiums where they're close together. And what we know about this virus is being close together is not a great idea. People are supposed to be 6 feet apart and try and minimize the contact. So I think we need to figure out ways that schools can reopen safely for children and for young adults, because we've got to balance them learning and being in an environment of safety and not risking their health, and not risking that by going to school to learn, they bring disease home that they then give to their parents and perhaps their grandparents. And I think that's the balance that health officials are going to look at. Nothing's going to be terribly easy until we get a vaccine.
When a vaccine is finally available to prevent COVID-19, what is the government's role in deciding who gets it first?
Well, that's a great question. I was secretary under President Obama, and we had a different kind of pandemic in 2009 and 2010, but it needed a vaccine. And what the federal government did under President Obama's leadership was to purchase 100% of the vaccine that was available for the United States, and then distribute it based on guidelines put out by the Centers for Disease Control, who was likely to be most affected by the disease. We did it on a per capita basis.
What can the government do to help people rebuild their lives?
Well, I think some of that is going on right now. Congress is trying to provide money to business owners quickly, so hopefully they can keep some of the employees who have to stay home for health reasons continue to be paid. So when it's safe to reopen the businesses can come back to life. For workers that are laid off, Congress has provided some resources for unemployment insurance so they can collect money and pay their rent and pay for food on the table and pay to take care of their kids. I think we're going to need a period of time. I would love to see Congress forgive student loan debt. So a lot of the people who are carrying a lot of debt and now have lots of extra bills with this crisis can get out from under that debt, or at least to have a way to forgive the bills that are piling up during this period of time. And I think it's going to take a while. People who didn't have a lot of money in the bank to begin with are going to have no money, and they're going to have bills that they owe. So helping people recover financially is going to be very, very important as we make sure that people who, we talked about the Affordable Care Act and providing insurance coverage to people, but I hope that the federal government says all the expenses related to COVID-19, getting tested, getting treated in a hospital, getting follow-up, rehab treatment, going to the doctor, checking out your situation, that those are all covered so people don't end up in real financial difficulty because they happen to get a virus that they didn't know existed.
Thank you so much, Secretary Sebelius.
Well, I have to tell you, Makayla, this is one of the best interviews I've had in a long time. So congratulations. You've only been at this for 3 years, but you're a master.
Thank you.
You're welcome.